So for this video, I'm going to perform the head and neck assessment to my patient. So before we start the procedure, make sure to perform hand hygiene to prevent cross-contamination. So first, we're going to inspect the hair and the face of the patient. So inspect the overall appearance of the face and make sure that the ears and the eyes of the patient are on the same level. So it is on the same level. Next is the head, an appropriate size for the patient's body. So it is. And then next, we're going to check if the face of the patient is symmetrical, like there is no drooping on the other side. So there isn't any. So next, we're going to check if the patient's facial expressions are symmetrical, like there is no involuntary movement or like twitching. So there isn't any. And then we're going to also inspect if there are any lesions. So there is none. And then we're going to test the cranial nerve number 7 or the facial nerve. So in order to test this, I'm going to have my patient close your eyes, smile, frown, puff out cheek. So as you can notice, my patient did it very well, did it with ease. So that means that her cranial nerve number 7 is intact. So next, we're going to palpate the cranium and inspect the hair for any infestations, skin breakdown, or any abnormalities. So first, we're going to palpate for any masses or indentation. And then next, inspect for any skin breakdown. And also inspect for any infestations like lice or any signs of alopecia. So before anything else, I'm going to don my gloves first and perform hand hygiene. Then next, we're going to palpate the temporal artery bilaterally. Then we're going to proceed to test the cranial nerve number 5 or the trigeminal nerve. So this nerve is responsible for many functions, and one of it is mastication. So in order to test this, I'm going to have my patient bite down and feel the masseter muscle and the temporal muscle. After that, I'm going to have my patient to try to open her mouth against resistance. So next, I'm going to palpate the temporomandibular joint and have my patient to try to open and close her mouth and feel for any grating or clicking sensation. So there is none. And now we're going to palpate the frontal and maxillary sinuses for tenderness. So in doing so, I'm going to put a little pressure on the maxillary and ask my patient if she feels any pain while doing so. You feel any pain?
No.
Frontal?
No.
So that's it. So next, we're going to proceed to the eyes. So we're going to inspect the eyes, the eyelids, the pupils, the sclera, and the conjunctiva. So first, we're going to assess if there is any swelling on the eyelids. So there is none. And then, we're going to check if the sclera is white and shiny and not yellowish as in from jaundice. So it is normal. And then we're going to check if this conjunctiva is pink and not red or swollen. So it is still normal. And then we're going to look for any signs of strabismus or aniscoria. So none. And lastly, we're going to assess if the pupils are clear and not cloudy. So they are both clear. So after that, we're going to test the cranial nerves number 3 or the oculomotor, cranial nerves number 4 or the trochlear, and cranial nerves number 6, the abducens. So there are many ways in order to test this. So the first is I'm going to have my patient follow my pen light and have it moving in 12 to 14 inches away from my patient's face. And then follow or proceed to the 6 cardinal fields of gaze. So in doing that, we're going to note for any nystagmus or involuntary eye movement while doing the process. So there is none. So it is normal.
So next, we're going to test if it is reactive to light. So first, we're going to have our patient look at a distant object, then shine the light in from the side in each eye, and note for the pupil response. The eye with the light shining in it should restrict, and the other side should also restrict as well.
So next, we're going to check for accommodation. So in this, we're going to make the lights normal and have patient to look at the distant object, and then we're going to have the patient stare at the pen light and slowly move it closer to the patient's face. And note for the pupil's response with it. So that's it. So next, we're going to move on to the ears. So we're going to inspect the ears and check if there are any drainage or any abnormalities, if there are any redness or if it is swollen. Then next, we're going to ask the patient if there is any tenderness that she is feeling or experiencing, and palpate also the ears. So is there any pain that you feel? Okay. So after that, we're going to palpate the mastoid process for swelling or tenderness. So that it is located here. So is there any pain or like tenderness? Okay, so it is normal. Next, we're going to test the cranial nerve number 8. So in doing this, I'm going to make my patient occlude one of her ear, and I'm going to whisper 2 words and have the patient repeat what I said. Red, yellow. And you're going to do it on the other side also. So next, we're going to inspect the tympanic membrane, and in doing so, we're going to use an otoscope. And since I don't have one, we're just going to pretend that this pen light is an actual otoscope. So we're going to look at the tympanic membrane and use the otoscope. And it should be pearly gray, translucent, and shiny. And then next, we must also take note for the position of the cone of light. So for this patient, her ear is just normal. So we're going to move on to the nose. So in inspecting the nose, we're going to note if it is symmetrical. So it is. And then we're going to ask if the patient have any drainage or discharge. So are you having any drainage or discharge?
No.
Okay. So next, we're going to use our pen light to shine it inside the nose and look for any lesions, redness, or polyps. So it is normal. And then I'm going to have my patient close one nostril and have the patient breathe out of it, and do the same for the other. Okay. So next, I'm going to test cranial nerve number 1, or the olfactory nerve. So in this, I'm going to have my patient close her eyes, and I'm going to place something with a pleasant smell under her nose and make her identify it.
Strawberry cologne.
So as you can see, my patient was able to identify it. We're going to move on with the mouth. So first, we're going to inspect with the lips. It must be pink and not blue, cracked, or dusky, and is free from any lesions. So it is normal. And then we're going to test cranial nerve number 12, or the hypoglossal nerve. In this, I'm going to have my patient stick out her tongue and make her move it from side to side. So as you can see, my patient was able to do it with ease. So it means that her cranial nerve number 12 is intact. So next, we're going to inspect the insides of the mouth and note for the color of the mucous membranes and the gums. So it should be pink and shiny. The teeth also must be white and must be free from any cavities. Note for any broken teeth or loose teeth. So it is normal. So next, we're going to inspect the tongue. So for the tongue, it must be moist and pink. It should be free from any cracks, or it should not be dry and not be beefy red. And also, we must check what's underneath the tongue. It should be free from any lesions or sores. So it is just normal. We're also going to inspect the hard and soft palate and tonsils, and the uvula should be midline. So it is midline, so everything is normal. And then we're going to test cranial nerve number 9, or the glossopharyngeal. And in this, we're going to have our patient say ah, and the uvula will move up if the cranial nerve number 9 is intact.
Ah.
So it moved, so it is intact. And then next, we're also going to check the patient's gag reflex. I'm just going to push this a little further. So it is normal. Her gag reflex is normal. As you can notice, the patient was able to swallow with ease and has no hoarseness when talking, which means that the cranial nerve number 10, or the vagus nerve, is also intact. So next, we're going to move on to the neck area. So first, we're going to inspect the trachea and have the patient extend her neck. So make sure that the trachea is in midline, and note for any lesions, lumps, or any enlarged lymph nodes. And then next, we're going to test the cranial nerve number 11, or the accessory nerve. So in this, I'm going to have my patient move head from side to side, then up and down, and then shrug her shoulders. So as you can see, the patient was able to do it at ease. So that means that her cranial nerve number 11 is still intact. We're going to inspect the jugular vein distension. So in this, I'm going to have the patient turn her head to the side and note any enlargement of the jugular vein. So there isn't any. And then we're going to palpate the lymph nodes with the pads of our fingers and feel for lumps, hard nodules, or tenderness. So do you feel any tenderness?
No.
Okay, so next we're going to palpate the trachea to confirm that it is in midline. So it is in midline, and then next we're going to palpate the thyroid gland from the back and note for nodules, tenderness, or enlargement. So there isn't any, it is normal. And then we're going to palpate the carotid artery. So we're going to locate it on this side first. So it is 2 plus, so it is normal. We're going to locate it on the other side also. So it is the same, 2 plus, so it is normal. So lastly, we're going to auscultate the carotid artery with the use of our stethoscope. So in this, we're going to have our patient breathe in and breathe out and hold it while listening. Breathe in, breathe out. Okay, so it is normal. So that's the end of our head and neck assessment.